Hi, and welcome to Kidney Plugged In. Joining us in our studio today is Suzanne Solven from Pacific Blue Cross. Suzanne will walk us through the process of how drugs get to market and into the hands of patients. Then, on We've Got You Covered for COVID, we share more tips to help you manage your daily activities through these challenging times of COVID-19. And in keeping with physical distancing recommendations, the Kidney Walk goes virtual on June 7th. And as the momentum builds, people are showing us their best, their worst, their silliest, and their wackiest moves in our Walk Like Nobody's Watching campaign. You don't want to miss those videos, and why not send in your video and join in the fun? All of this is next, right here on Kidney Plugged In.
Welcome to Kidney Plugged In, where we've got you covered for COVID. Kidney patients stay safe. The news is changing daily. The virus is spreading. It is more important now than ever that you put your health first during this pandemic. Here are some simple but important tips to help keep kidney patients safe during the COVID-19 outbreak. Stay at home whenever possible. Wash your hands well and frequently. Avoid touching your nose, mouth, and face. Cough or sneeze into a tissue or your sleeve. Clean and disinfect frequently touched objects and surfaces in your home. If you are on dialysis, please do not skip your treatments. Call your clinic if you're feeling unwell. Avoid contact with those who are sick. Have a good supply of your prescription medications on hand. We are plugged in, and we've got you covered for COVID.
Kidney Walk goes virtual, and people are walking like nobody's watching. They're sending us in their videos of their best, their worst, their craziest, their funkiest, their silliest walk. Why? Because at times like these, kidney patients need our support more than ever. And the Kidney Walk is showing them that we've got their backs. So join us, won't you? And send us your craziest walk, like nobody's watching.
Today we're going to tackle a really interesting topic on how drugs are brought to market. Specifically, we're going to explore how drugs get developed and approved through Health Canada, and then we're going to look at how the provinces and territories then decide what drugs get covered and reimbursed, and eventually how these drugs get into the hands of patients and their role in this process. Joining me in studio today is Suzanne Solven. Suzanne is the Associate VP of Audit, Investigations and Quality Assurance with Pacific Blue Cross. Prior to that, Suzanne was the Deputy Registrar with the College of Pharmacists of BC and the Executive Director with BC Pharmacare. She is also a trained pharmacist. Welcome, Suzanne.
Thank you.
So I thought today we'd start off maybe with a sort of a broad question. Obviously, here in Canada, before drugs are approved for use, they go through a very rigorous process. Can you take us through some of the key steps involved in that process?
Absolutely. So for a drug to become available for sale in Canada, a manufacturer has to conduct rigorous clinical trials for specific indications that they're looking to get approval for, and then submit that clinical dossier to Health Canada. Health Canada is a branch of the federal government, and so they're responsible for looking at determining whether the drug is efficacious, which means does the drug really work in the indication that it's being sought for, as well as is it safe? So we want to make sure that the drug is safe for people, and it's always this balance between balance and risk of safety and efficacy. The other thing that Health Canada looks at is also the quality of the manufacturing that takes place. So Health Canada actually goes around the world and inspects facilities to make sure that there's quality in the manufacturing so that the public can be assured from batch to batch that it's safe, that it's clean, it's sterile if necessary, and that you have consistency of the medication. So the manufacturer submits this clinical dossier to Health Canada, and then Health Canada takes time, and it's reams and volumes of scientific information that they have to look at to determine has the manufacturer actually proved that the drug works and it's safe. So it goes through that large process, and that can take sometimes quite a bit of time depending on the volume of material.
We may be talking years here.
You could be talking
Right.
years, but usually a year or so, maybe 18 months, something like that.
And then so through this process, there's obviously sort of the initial testing, but there's also something you were saying around sort of the clinical trials.
Exactly. So we usually refer to them as phases. So
Okay.
there's phase 1, 2, 3, and there's actually a phase 4 once the drug comes to market. But a manufacturer goes through a series and progression of trials, and so they'll try it out first in limited populations to determine, is the drug actually effective, and are there any serious safety signals, because they want to make sure that the drug doesn't have anything that's going to cause some serious consequences for people. So once it gets through the first and second phase and third phase, it's trialed in human populations, and in clinical trials, which is really important for some of the things that we'll discuss later, it's in very limited populations, because to be rigorous in clinical trials, you have to control all the different variables to be able to actually prove, does the drug work? And so there's various protocols they have to go through to control the different variables there. And so it gets to phase 3, and they're really controlling, one, the indication, which is, what that means is, are they trying to show that it lowers blood pressure or lowers cholesterol or treating an infection? So it's a specific indication that they're trialing. And then they limit those populations for individuals that have the specific concern. But they're also looking at, do patients have other what they call comorbidities, which means, do they have diabetes, do they have renal disease, do they have other kinds of conditions that could impact the response to drugs.
So that's really great information, Suzanne. We want to deep dive into that when we come back. So please stay tuned and don't go anywhere.
Kidneys are cool. Kidneys are cool. Come on, everyone, it's kidney walk time. So cough up some dough. Let's make this go. The big show. We want you to donate. Come on, Nanaimo. Let's kidney walk go.
Welcome to Kidney Plugged In, where we've got you covered for COVID. In this time of COVID-19, it is more important than ever to take care of ourselves. Here are some easy ideas to get you started. Eat well-balanced meals. Contact family or friends virtually, by phone, or even snail mail. How about meditate, even for 2 minutes? Create a gratitude journal. Practice deep breathing. Listen to your favorite music. Increase your physical activity. A healthy body leads to a healthy mind. Limit upsetting media coverage. Do something kind. Get outdoors and spend time in nature. Dance, dance, dance. Create a new recipe. Read a book, or even 2. We're plugged in, and we've got you covered for COVID.
Je marche comme si personne me regardait parce que je sais que les patients atteints de problèmes au rein ont besoin de notre aide maintenant plus que jamais. Je veux leur montrer qu'on les soutient. Pour en savoir plus sur la marche pour les reins ou pour vous inscrire, visitez le kidneywalk.ca. I'm walking like nobody's watching because I know that kidney patients need our help now more than ever. I'm showing them that we've got their backs. To find out more about the Kidney Walk or to register, visit kidneywalk.ca.
So once Health Canada has approved the drug, is this drug now available for all Canadians to use?
Yes and no. So it's approved for sale in Canada, which means any prescriber, physician, nurse practitioner can prescribe the drug. The Health Canada approval, as I mentioned, when it goes through the clinical trial process and approval process through Health Canada, is for specific indications. And so it gets approved for those specific indications, and that's what it's available for the prescribers to prescribe it in those indications. But that's available for sale and prescribing. That doesn't mean it's eligible for coverage. So there's then an access issue for patients around whether they can afford the drug or not. So even if they get a prescription, sometimes what we see in pharmacy is that people don't pick up their prescription because they can't afford it, and that gets into the whole coverage issues.
So let's talk about that a little bit. How then do people who need these drugs, how do they get them covered on their plans?
So there's different kinds of coverage. There's public coverage, which is through the provincial governments. And an important fact that sometimes people aren't aware of is the Canada Health Act covers physician services and hospital services, but actually prescription drugs were never included in the Canada Health Act. And so provincial drugs are covered provincially. And so that's why you will see differences across the country as far as the provincial programs in who they cover, what they cover, and to what extent of how they cover it from that perspective. So
it's actually the provinces then, and respective provinces and territories, that are making the decisions on whether or not a drug gets covered and put into the formulary?
Correct.
Right, okay.
That's correct. So that process has developed over several years, and there's various steps to that particular process. And how that works is that the provinces look at, so Health Canada looks at, from the safety and efficacy that I talked about, the provinces are really looking at, you'll hear these terms, value for money, cost effectiveness. And so what they're trying to understand is, for drugs that they already cover on the formulary, how does this new drug compare from a cost effectiveness perspective? So they're doing the comparisons. Something I forgot to mention from the Health Canada process is that usually when a drug comes to market, it's versus placebo or an inert substance that has no effect in your body. There are more and more, it's happening now, what we call head-to-head trials, where a drug is compared to a drug that also has activity in your body, but a lot of times drugs gets approved when it's just versus placebo. So that doesn't help the provincial governments when they're trying to decide whether to fund a drug or not, because they want to know how does it compare to drugs that they cover, and if the clinical trial evidence, you don't actually have that head-to-head comparison, it's difficult to do. So there's various scientific methods that they do. You hear terms like meta-analysis and those kinds of things, where they'll look at other clinical trials that have been done in comparator drugs and try to make those comparisons, but it's challenging because you have different trial designs and you have different patient populations. So what they've done is they've established expert bodies and processes. You may have heard of CADIT and the Common Drug Review. CADIT is the Canadian Agency for Drugs and Technology in Health, and they house the Common Drug Review. They're the secretariat for that. And it's a group of experts that look at the clinical cost effectiveness perspective, as well as they do a pharmacoeconomic review as well. And so it's really trying to get at that value for money question.
I think one of the things that's interesting here too is that patients, caregivers, physicians can weigh in or have a voice in the drug review process. And I think it's on the federal and on the provincial level. Is that
Yes,
correct?
So it's being recognized over the last several years how valuable the patient input is into these review processes. They really need to understand the patient's perspective. What value or what challenges do patients experience, and what does that mean for them? So, for example, if a patient's exhausted all treatment options and this new drug actually provides value to them, that's a really important point for the experts when they're doing their reviews to really understand that perspective. So it's important for patients to educate themselves, either them individually or through an advocacy organization. And then the Common Drug Review actually has a patient voice way that you can give your perspective through those drug review processes, and it's all on their website.
And so we'll run that website, so if there is someone out there that would like to, lend their voice and be part of an upcoming drug review then they can go to that website and find out how to get involved in that process.
Absolutely. So what the Common Drug Review does is they review the evidence, as I mentioned, from the cost effectiveness perspective, and then it goes to an expert committee who then makes a recommendation to the provinces. So Common Drug Review is established by the provinces and territories and the federal government, and it's a recommendation-making body, because at the end of the day, the provinces are the ones that have to determine, can they afford to list the new drug or not on their formulary. So the recommendation from the Canadian expert group is to say yes, based on our review and the clinical evidence and pharmacoeconomic review, we think there's value. So yes, we think you should list it. They might say, yes, list it, but only if the cost is less expensive. The manufacturer should consider lowering the cost of the drug. Or they could say, no, we don't think the clinical cost effectiveness evidence is strong enough, and we recommend that the provinces not list the drug. Once that happens, then there's another body called the Pan-Canadian Pharmaceutical Alliance, which was also set up through the territories, provinces, and federal government. Really, their goal is to enhance access by negotiating better prices with manufacturers. And in that way, it also ensures consistency across the country as far as the price that provinces and provincial and federal programs would pay for drugs that are on the formularies. And so that Pan-Canadian Pharmaceutical Alliance, again, is a recommending body that they go through a process, they do the recommendations, and then they provide a recommendation through what they call a letter of intent. The province, again, has the option to accept it or not. And it really comes down to a couple of things from the provincial perspective is, one, do they actually have the budget to fund the drug or not? Just like individuals, we all have limited funds, and you have to make those, value for money decisions. There's finite resources. So the province looks at that. They look at, are these drugs that we actually cover on formularies? Because there are certain categories of drugs that aren't covered. And then they look at, if we are going to cover it, are there special circumstances? If it's more expensive, perhaps we need to limit the population that gets access to that. And how they do that is looking at the clinical trial criteria.
We've been hearing in the media a lot about the National Pharmacare Initiative, and you're talking about the provinces are the ones, obviously, that ultimately make the decision on will a drug be included in their formulary and the pricing around it. So with this National Pharmacare, is this something that could provide greater equity across the provinces and territories?
Yes, that's the whole idea behind National Pharmacare. There's been a lot of reviews done by various experts across the country looking at the inequities. And so when I talked earlier about the Canada Health Act and how drugs aren't covered and it's provincially covered, there are inequities on who is covered. So for example, in British Columbia, we cover everybody that has medical services coverage. They're eligible for pharmacare. There's different plans and different structures, but ultimately everybody's covered. A lot of the other provinces only cover those on social assistance or seniors, and so most of the general population isn't covered. And so it's those inequities that it's trying to address. And so it's still not decided where National Pharmacare is going to land. There's a lot of different perspectives of what that should look like, but I think we're moving closer and closer, and we might see something in the next couple of years.
So Suzanne, this is so informative. Can you stay with us just a bit longer?
Oh, I'd love to.
Great, so don't go anywhere.
I'm walking like nobody's watching because kidney patients need our support now more than ever, and we're showing them that we've got their backs. To learn more, head on over to kidneywalk.ca.
Welcome to Kidney Plugged In, where we've got you covered for COVID. COVID pandemic, it is important to have a supply of food, 2 to 3 weeks worth, in your pantry in case you need to quarantine for a period of time if you become ill. Stock up on foods that you know are safe for you to eat, low potassium, phosphorus, sodium as required. If you become unwell, good nutrition will help you recover faster. Check expiry dates and choose products with a long shelf life. Here is a sample pantry shopping list. Frozen or canned fruit, including berries, applesauce, peaches, pears, and pineapple. Frozen or low-sodium canned vegetables such as green beans, carrots, or cauliflower. Canned tuna or boneless salmon. Eggs. Frozen chicken, fish, or meat. Plain rice, pasta, or couscous. Bread, buns, or English muffins. Low-sodium crackers. Boxed cereal such as puffed rice corn bran cereal or shredded wheat. Oatmeal or farina cereal, oil, butter, or margarine, cream cheese, jam, jelly, or honey, peanut butter, juice boxes, plain cookies, milk alternatives like almond or rice milk, glucose tablets if you have diabetes. We're plugged in and we've got you covered for COVID.
Let's see, so kidney is a...
These are my grandpa's kidney stones. They're very precious.
Kidney is a bone in your back that helps you turn.
I don't know, to be honest.
They don't know kidneys are vital, do you? Get the facts at kidney.ca.
Hey everyone, I'm Suzanne Skidmore and I'm the Secretary-Treasurer of the BC Federation of Labour. I'm walking like nobody's watching with my tiara on. I live in Queen's Park in New Westminster, and so I figured I'd walk today with my tiara and walk like a queen. I think it's important that we all participate in this year's kidney walk now more than ever. Kidney patients need our support and we need to show them that we have their backs. And so I'm hoping you'll join me this year and have some fun. Go out and walk like nobody's watching.
What other roles should patients, or what other role can patients play in this whole process?
Well, you're the most important. You're the patient. We talk about patient-centered care. As healthcare professionals, we're always talking about patient-centered care. You're the one that matters. You're the one that's being treated. So you have a role because you need to take a responsibility for your own care, but reach out to your healthcare professionals, your physician, your pharmacist. Pharmacists are the most accessible healthcare professional. They're experts in drugs. That's their training. So if you have any concerns at all, take the time to build the relationship and have those conversations. And pharmacists can do what we call medication reviews. Governments recognize that that's really important, especially for people that are on several medications, and kidney patients, may be on several medications. So it's really important to take advantage of these opportunities and speak to your professionals. Even if you don't have any concerns, it's helpful for them to do a medication review to check in with you. You may not even realize that you might be experiencing some side effects or other adverse events, and you may not have put the cause and effect together. So it's really important to take charge of your own health and initiate conversations, even during, as I said, times when you're feeling really good. It's all, at the end of the day, it's all about your quality of life and enhancing your health outcomes. That's what it's about.
Check out Kidney Plugged In, where we've got you covered for COVID. We know that grocery shopping during this time of COVID-19 can be a challenging experience, but here are some grocery shopping tips to help minimize the health risk and make your shopping experience go smoothly. Before you leave to go shopping, put on shoes and clothes that are different from the shoes and clothes you wear inside the home. Take alcohol wipes or disinfectant wipes with you. You can also take paper towels and disinfectant. And when you arrive at the store, use the wipes or paper towels sprayed with disinfectant to disinfect the handle of your cart before touching it. Remember to try to stay 6 feet away from everyone when browsing the aisles or when you're in the checkout line. Grab only the items that you need and try not to touch the items that you're not going to buy. Try to pay with a credit card whenever possible. And when you're back in your car, use hand sanitizer or spray disinfectant on your hands. When you arrive home, remove your shoes at the entrance of your home. Wash your hands thoroughly with soap and water. Wipe down your kitchen table with disinfectant. Cook the vegetables you purchased because the virus will be destroyed when cooked. Wash all the fruits you purchased with soap and water and then rinse well before you put them in the fridge. The virus will be destroyed by the soap. Remember to disinfect door handles, fridge and freezer handles, and change your clothes. Put on safe house clothes if you think you were exposed to anybody coughing or sneezing outside. Then relax and reward yourself for having taken control of your life, your health, and your safety. We're Kidney Plugged In. We've got you covered for COVID.
Because I was lucky enough to donate my kidney to someone in need.
Check out Kidney Plugged In, where we've got you covered for COVID. Many of us live in apartments where riding the elevator is a common daily routine. But now, in the time of COVID-19, this activity can present a new challenge. Here are a few simple tips to stay safe. If at all possible, avoid the elevator, like you might avoid other high traffic areas, and take the stairs. Try to ride the elevator when it's empty or not during peak times. If you do get on the elevator with other people, then face the wall. And think about those high touch areas like elevator buttons. Don't touch your face. Wear a mask if you can, and always wash your hands as soon as possible after that elevator ride. We're plugged in, and we've got you covered for COVID.
So we're gonna have a little fun. I thought we could test your acronym IQ. Are you ready?
I'm ready.
CADA.
Canadian Agency for Drugs and Technology and Health.
BCPRA.
The BC Provincial Renal Agency.
TPD.
Therapeutic Products Directorate.
HPFB.
Health Products Food Branch.
CDR.
Common Drug Review.
PCPA.
Pan-Canadian Pharmaceutical Alliance.
LCA.
Low Cost Alternative.
PSD.
Pharmaceutical Services Division.
Woo, you did it! Fantastic!